Before exploring this, it's important to recognise what we mean by self-care. So when looking at a definition, the Self-Care Forum's definition of self-care is the actions that individuals take for themselves, on behalf of and with others in order to develop, protect, maintain and improve their health, well-being or wellness. In other words, this is about recognising when we can look after ourselves before needing the assistance of others such as the GP, pharmacist and so forth. This self-care ensures that we get the time needed to do things that make us happy and boost our mental well-being, all of which can have a positive impact on our mental health. One commonly misinformed view around self-care is that it's selfish. The idea that it is selfish to take this time for ourselves can often lead to people feeling guilty about engaging in self-care activities. This guilt can usually lead to two scenarios occurring. Firstly, a person will feel guilty about taking it and therefore not take any time at all, or a person may feel that they want to take the time for themselves, but because they feel guilty, they won't prioritise this time, and this leads to self-care being put at the bottom of the priority list, and engagement in these activities being very sporadic. As a result of this misinformed belief that it's selfish, we may find ourselves in a position that we have to be really deserving, or be able to justify our reasons for self-care before we take it. For example, I need to have worked 16-hour days before taking this, or I need to work 2 weeks straight first. This can be really counterproductive in terms of maintaining and/or improving a person's mental health. Another way to look at it is if we don't look after ourselves, how can you help support and encourage others to look after themselves as well? For example, you might be a parent or carer. In this role, when are you going to be able to offer better support? When your mental health isn't under pressure from a lack of self-care, or when your mental health is being supported through regularly engaging in self-care activities. What we do know is that self-care techniques can certainly help manage and sometimes improve the symptoms of many mental illnesses. Knowing how effective self-care can be when we really need to challenge the current idea that self-care is selfish and stop people feeling guilty about doing it. Therefore, when talking about self-care, it's important that we make this a priority. We need to move away from this idea that it's indulgent or extravagant and see it as a necessity to maintaining and improving our health. There's lots of guidance and ideas on self-care, but what is really important is that we find the method of self-care that works for us. And what we will do now is explore the different ways in which we can engage with self-care and look at some of the recommendations which can be offered.